the question came in. You've shared on past webinars about the finances of the district. And so how did the hospital do in the month of August?
Yeah, not well, not well. Very timely question. So on Monday, Melinda Tupper, our Chief Financial Officer, sent out an email to our executive team, basically showing us how we performed for the month of August. So our fiscal year started July 1, so we're 2 months into it now, at least 2 months that have been fully completed, July and August. And unfortunately, for the month of August, we experienced, now this is pre-stimulus funds, so if it wasn't for CARES Act funding that has come in but is about to stop unless Congress acts again, we had a $4.6 million operating loss for the month of August. That compares to a $980,000 loss last year in August. So the summer months don't tend to be really profitable months for hospitals because so many people are taking vacations, and so they're not having surgery over the summer. A lot of our physicians, our surgeons take vacations. The census tends to be lower, and so the summer months are kind of a bit of the doldrums from a financial performance standpoint. But 4.6 million. We had actually budgeted a loss for August because remember, as I mentioned a number of meetings ago, for this fiscal year that we're in right now, we actually adopted a budget that has a 0 operating margin. We intend to just break even. But we also, we know that in the summer months, we're probably going to operate at losses, but then it improves over the winter months. We hit flu season and so forth. So we actually budgeted for a $550,000 loss for the month of August, but certainly not 4.6 million. And we were $3 million under budget in revenue and about $1 million over budget in expenses. Much of that over budget in expenses is driven by COVID. We had, August was an incredibly busy COVID month, and we lose a significant amount of money on every COVID. They're very expensive to take care of. We consume a lot of labor, a lot of supplies, drugs, things of that nature. So that's why we're running over budget on the expense side. And on the revenue side, it was really interesting. I mean, surgery is still kind of, depressed a little bit intentionally, right, but we are kind of opening that back up. But we also saw some pretty big declines in our outpatient businesses, clinic visits, things of that nature. And again, I don't know if that's just summer or if there's still a big part of the population out there that is still nervous about getting that MRI done or that CT or having their annual physical done or their colonoscopies, things like that. So we just saw really some low volumes in that area. But fortunately, we do have those stimulus funds. We received almost $12 million in the month of July. That was part of the CARES Act 3.0. So that's the last CARES Act funding that we've received, was back in July. But it was to help us, get through these months. Although when we put this budget together, we had no idea if COVID was still going to be around come July 1st. But so we're taking that 11.9 million roughly into income evenly in the month of July, August, and September. So we recorded about $3.8 million in stimulus funds, CARES Act stimulus funds, also in the month of August. So when you take that into consideration, our operating loss for the month was $889,000. So just a few $100,000 higher than the $559,000 that we had budgeted. So that's good. We're not lighting our hair on fire, but it runs out in September. So September will be the last month that will record that 3.7 million in stimulus fund revenues from what we received back in July. And but there's still $57 billion that's sitting with Congress that is waiting to be distributed to hospitals. They appropriated $100 billion and they distributed $43 billion of it, and they're sitting on $57 billion. So you know, the American Hospital Association, hospitals across the country who are in the exact same situation we are right now, is, you know, pleading with Congress to release those funds, because come, you know, October 1st, we're on our own. There's no funding really coming from the state whatsoever. It is all coming from the federal government. And as we continue to, you know, pay incredible, you know, labor costs, and I have no qualms about it. I mean, again, I'm so grateful to all of our nurses, our RNs, LVNs, our CNAs, for working extra shifts or working all the overtime. You know, I want to provide them financial rewards and incentives for doing that, but there's no funding that's coming in to cover that
Right.
cost. And so we are desperate from that standpoint.